Well, good afternoon. Over the past 8 months, our government has made massive investments in response to COVID-19. We gave our partners every tool and resource. $50 million to improve HVAC and ventilation in our schools. Over $60 million to help long-term care homes renovate and improve infection prevention and control. And we provided our municipal partners with over $500 million to help protect vulnerable populations, including homeless shelters, women's shelters, and food banks. It has truly been a team effort right across our province, but the job is far from over. Today, we are sending in more reinforcements, and I am pleased to announce that we are launching applications for the all-new COVID-19 Resilience Stream. This new federal provincial funding stream will make more than $1 billion, and I repeat that, $1 billion available for municipalities, Indigenous communities, long-term care homes, schools, and daycare centers, and many other community projects. That's over $1 billion to get shovels in the ground on critical infrastructure that will help communities stop COVID-19 in its tracks and build for the future. The construction of these projects will create hundreds of jobs, support local businesses and suppliers, and improve quality of life for so many people. The projects will vary depending on the need. Projects like retrofits, repairs and upgrades for municipal buildings like fire halls and police stations, improving ventilation and HVAC systems in long-term care homes and schools, making renovations that will improve physical distancing in shelters and recreation centers, or helping communities become more resilient to flooding and other natural hazards. These are just a few possibilities. We don't believe in a one-size-fits-all approach. We want communities to be able to put forward their priorities because they know their local needs best. And we must and we will support them. That's why I've joined my fellow premiers in calling on the federal government to make more funding available for infrastructure projects. We've submitted over 760 projects to the federal government's ICIP program, but only half of those have been approved. There are an additional $10 billion worth of projects waiting to be funded. We need the federal government to make a renewed commitment to infrastructure. This is critical to support the long-term recovery of our province and our country. That means investing $10 billion every year over 10 years to get shovels in the ground on new projects to help communities get back on their feet. It's what the premiers have asked for, and I've been leading the charge because it's absolutely necessary. Here in Ontario, we're going to continue to make strategic investments in infrastructure in every corner of this province. And our government will have more to say about our Made in Ontario plan to rebuild and recover on November 5th when we release our 2020 budget. But today, we're taking the first of many steps to lay a strong foundation for our future. By working together, our recovery will be fueled by growth and driven by the Ontario spirit. Thank you, and God bless the people of Ontario. Now, I'll hand it over to Minister Scott.
Well, good afternoon, and thank you, Premier Ford. To echo your remarks, today we have very good news for schools, for long-term care, and for municipalities, and for the people across the province. Each and every day, the Premier and our government are moving as fast as we can to respond to the ongoing challenges of the COVID-19 global pandemic. This COVID-19 resiliency stream is no different. The funding being announced here today is a direct response to the federal government's request for provinces to use existing funding from the Investing in Canada Infrastructure Program, known as ICIP. This is funding coming from future investments moved up to meet the demands of the COVID-19 global pandemic. Ontario has worked with the federal government to ensure there was flexibility so we could get the funding to where it is needed most. As the Premier said, Ontario has worked hard to make sure that communities, schools, and the healthcare sector are able to get shovel-ready projects underway sooner so they can kickstart their local economies. This is good news for Ontario. Minister Lecce, Minister Clark, and Minister Fullerton will be providing more details on what that means for their ministries. We'll work closely with Minister Clark and his officials to flow the municipal dollars to each and every one of the 444 municipalities as fast as we can. This stream will be open the week of November 16th. All municipalities will be contacted between now and then with information about the COVID-19 stream and the application process. Our government submitted over 760 projects to the federal government for approval, and a little more than half have been given the green light. We remain hopeful the remaining projects will soon be approved so that together we can get those shovels in the ground, create jobs, and keep our economy working. In the meantime, the Premier and my Cabinet colleagues will continue to press the federal government for new funding to make additional investments in infrastructure projects and broadband in Ontario. I will now let Minister Lecce bring you the good news for schools in Ontario. Thank you.
Well, thank you, Minister Scott. Today, our government is taking another major step forward to ensure that our schools remain safe. We are fully funding our plan, over $1.3 billion of investment. We lead this nation with the most comprehensive protocol and with the most amount of investment flowing to protect our schools. And today, we're taking a major step forward, $700 million of new investment to ensure we further support the safety of our schools and our kids. This investment is going to help us improve HVAC and air quality. It's going to help us retrofit and build repairs within elementary and secondary schools, as well as in our childcare centers. The money is going to flow quickly. We're going to work very hard with our school boards to ensure that the monies flow from the federal government, which is why we are ensuring that this process will be seamless. We are committed to stepping up our investment every step of the way, as we have done ably through this pandemic. And we are grateful for our frontline staff, our teachers and our doctors and our nurses and our EAs and principals, everyone, including our parents, doing everything they can to mitigate the risk. This investment is going to build on that and again ensure that in this province we continue to keep all kids and all staff safe in the province of Ontario. I'd now like to turn it over to Minister Steve Clark.
Thank you, Minister. Our government has been working closely with our municipal partners to provide them with the tools and the resources they need to keep our communities safe and functioning. Today, we're taking further action to support our municipal partners with $250 million in federal, provincial funding to support critical local infrastructure projects. This funding will help ensure that our communities have strong, reliable infrastructure that meets their needs and helps them adapt to the new environment, which includes retrofits and repairs and upgrades to both municipal and provincial buildings, schools and long-term care homes, daycares, libraries, playgrounds, active transportation projects like bike lanes, disaster mitigation projects, and more. We know that municipalities are working hard to maintain vital local services for their residents and build strong communities. That's why we partnered with the federal government to provide municipalities with up to $4 billion in phased emergency assistance through the Safe Restart Agreement. We're also helping to ensure our partners have the flexibility needed to keep vulnerable people safe. We recently announced that municipalities and our Indigenous community partners are receiving over $241 million to help more than 110,000 Ontarians with their housing needs, including those who are homeless or at the risk of becoming homeless. This is a part of our $510 million commitment under the Social Services Relief Fund to help vulnerable people affected by COVID-19. Municipalities are a key part of our province's economic recovery, and investing in critical local services and infrastructure projects will make our communities stronger and more resilient. Together with our municipal partners, we are working to keep Ontarians safe as we start down the path to economic recovery. Now I'd like to call on Minister Fullerton.
Thank you, Minister Clark. Before I begin, I want to thank all of our hospital and public health partners who continue to support our loved ones and support our long-term care homes facing outbreaks. Your assistance is invaluable. Thank you. Our government has been working hard to create a 21st century long-term care system that is resident-centred, providing a safe place for Ontario's most vulnerable to call home. Over the next 5 years, we are investing $1.75 billion in long-term care homes to provide seniors with the quality care they deserve. Our government has committed to building 30,000 new long-term care beds over the next decade, beds that meet today's modern design standards and create a warm and caring environment. The Accelerated Build pilot program, which our government announced in July, will rapidly add much-needed capacity in urban centres like Ajax, Mississauga, and Toronto. And just this fall, we announced over $500 million in funding for long-term care. Today, we are pleased to announce that we are building on these investments with an additional $100 million to support minor capital repairs and renovations in homes, like improving ventilation and HVAC systems. This will help improve quality of life for residents and staff. And this past summer, the Premier committed to ensuring air conditioning would be available in every long-term care home. Significant progress has already been made, and this new funding stream will help us further deliver on that promise. We are committed to taking every step to protect long-term care residents, staff, caregivers, and visitors. And thanks to this combined federal-provincial funding for infrastructure, along with other investments, we are continuing to support the health and safety of our long-term care home residents. Today marks another important step in the modernization process, and this announcement brings us closer to providing the quality and care our loved ones expect and deserve. Thank you.
We'll go to the phone line for questions. First question, please.
First question comes from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. This question is actually for my colleague, Faiza Amin. She's working on the flu shots. And she says that pharmacies are saying they're turning people away from getting the flu shot, which is a major pillar of your campaign to stop COVID and help ease the pressure on hospitals. And pharmacies say they just don't have enough vaccinations. The demand is surging while supply remains at the same pre-COVID levels. Is the province considering increasing supply to pharmacies and also considering lowering the age for who can get a flu shot at pharmacies? And did you mess this up? Did you not order enough?
Well, we ordered it a year in advance, and we actually ordered more than we did last year. On top of that, we ordered another 300,000. So we have a total of 5.11 million, and I believe it was on Friday, last Friday, we have about 4.8 million out. The other 300,000 are going out as well. And then we're waiting for the additional 300,000. So again, we ordered this before COVID hit and hoping that it'd be enough. And I think we should have enough. We just have to get it distributed into the proper areas. We're focusing on the high priority areas, be it the long-term care or rural areas, First Nations communities, right across the province. But we've distributed over 4.8 million so far, and probably in the next 2 days I'll be up here saying we've distributed 5.1 million. So I think we've ordered enough, and we just have to make sure that the people get a flu shot.
Follow up?
Thank you. And my next question is about your MPP, Sam Oosterhoff. This doesn't seem to be dying down. A lot of people think that you've been going too easy on him for being in that gathering without a mask. I guess my question is, if your own MPP, who's a parliamentary assistant no less, didn't get the message, has your messaging failed?
Well, I don't think it's failed. You know, Sam acknowledged he made a mistake. He apologized. It's not going to happen again. But in context, I think we all have to do a better job, all of us, making sure that we practice the social distancing and masking and hand sanitizing. But Cynthia, the good news is I truly believe everyone in Ontario, all 14.5 million people, are doing a great job, and Dr. Brown will be out tomorrow and putting out information that we see the curve going down, which is great news. And I give all the credit to the people out there in Ontario, but we can't let our guard down. Just because we see it sloping down a little bit, it doesn't mean we let our guard down. So I just want to thank the people of Ontario. You're doing a great job. And let's keep it up because it's working. You look around the world, you look at Ireland shut down, complete shutdown. You see France complete shutdown, Germany, see what's happening over in the UK. And again, I always say it's not our government, it's the people. Without the people following the guidelines, and I look at these numbers and I'm literally cheering the regions on, no matter what region it is. I remember us cheering Windsor, Essex on, and other regions, so I'll be cheering on. But everyone's doing a great job, so thank you, everyone.
Next question.
Next question comes from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. Our first question is about gyms. So the health minister said today that she's been advised by health officials that fitness centers and gyms are a place where infection is happening. But the Senior Vice President of Operations with Good Life Fitness was on our radio station this morning, and he says that reopening this summer, they've had 6 million workouts in Ontario and have had 0 outbreaks linked to their facilities. And he also says for every 100,000 check-ins in the province, they've only seen 1.6 cases where there has been a pre-symptomatic person. He argues their health and safety protocols are standing up and that Good Life has not been identified as a point of transmission in any of their clubs. So hearing these stats, are you considering or will you consider reopening gyms on November 7th?
Well, thanks for that question, Haley. There's no one that wants to open up the economy more than I do. There's no one pushing the health table more than I do, and I have confidence that we're going to work with them. We're going to work with the 4 regions that are shut down. I've been in constant conversation with no matter if it's Mayor Watson or Mayor Tory or again the mayors in Peel and the mayors in York. We have to be collaborative. We have to work together and put a really good proposal forward to their local chief medical officers, but also we have to put a proposal to our health table because, you know, again, Haley, no one wants to get these restaurants opened up, these fitness centers and other places more than I do. And I'm seeing really great effort from the people of Ontario. Again, we're going to see a positive report from Dr. Brown tomorrow. So, folks, let's keep it up. I'm pushing. Like, you have no idea how hard I'm pushing to get things opened up.
Follow-up?
Thank you. And my follow-up is regarding this teacher who was fined for not wearing a mask at St. Charles Catholic School. Does this trigger any re-examination of COVID safety protocols in the schools, or is this just a case of a rogue teacher flouting the rules?
Well, before I pass to the Minister of Education, I actually got a message from a mom that their kids were being taught by this teacher and talk about angry. Oh my goodness, not angry at us, but angry that the teacher would not follow the proper protocols per se, but I'll pass it over to the Minister of Education.
Look, when it comes to the safety of children and vulnerable components of our society and our communities, we have to be very clear. There has to be absolute compliance with the protocols set out by the Chief Medical Officer, local public health, given that the province, that this government funded the training for health and safety of every single educator, including supply teachers in the province, on these protocols. We all have a duty to uphold them. And so largely, overwhelmingly, we're seeing, I think, educators and staff and students uphold their responsibilities in wearing masks and distancing, washing their hands. But when there are these types of circumstances, it's obviously important for parents, for their accountability, and for the safety of their kids that the Ministry of Labour takes action, which they have done in this instance. And we're going to continue to provide continuous training and continue to make the case to everyone within our schools to follow public health advice, especially when given a recommendation to stay home because of symptoms or because of a positive case. In these instances, it's obviously totally unacceptable, and I can appreciate why that parent would be very displeased And that's why we're continuing to step up training and making sure that the health protocols are well known to every staff member within our school boards.
Next question.
Next question comes from Antonella Artuso from the Toronto Sun. Please go ahead.
Thank you. Hello, Premier.
Hi, Antonella.
One of the more common signs on storefronts these days is for lease. And I'm wondering if your government will extend the commercial eviction ban past this week, at least until it's clear whether the federal rent relief program extension is working.
I'm all in favor of protecting all the small businesses. I'll pass it over to Minister Clark.
Thanks for the question, Antonella. We're certainly working diligently to ensure that the commercial eviction ban continues. We're just working as a government on the best way to bring that forward. Obviously, I had a standalone bill that dealt with it as opposed to SECRA, and now that there's a new government program, we're going to work with the federal government. But I think the Premier's been very, very clear. We want to do everything we can to assist businesses, so we'll have more to say in the coming weeks.
Follow up.
Thank you. And back to Cynthia's question about Sam Oosteroff. As you know, the restaurants and banquet hall businesses have suffered tremendously through this pandemic. And your MPP, a member of the Government of Ontario, walked into one of these family-run businesses and took off his mask inappropriately. So again, how can you accept his apology so easily? And what message does that send to all these restaurants that have to follow all the rules or face closure?
Well, again, Sam came out and admitted he was wrong. He's going to do better, and he will do better. We represent the people, and yes, you have to make sure that you follow the protocols. So we've accepted that with Sam. He's a very good man, a very good representative. But I understand what you're saying. We all have to do better. I have to do better. Sam has to do better. Everyone has to do better. So I understand what you're saying, and I'm confident Sam will continue to wear the face mask and follow the proper protocols.
Next question.
Next question comes from Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. I just wanted to get back to you're saying that the curve is flattening. Dr. Brown is going to come out with new projections tomorrow. Did I hear that correctly?
Yeah, Graham, I wouldn't go as far as flattening, but we see it going in the right direction, and that's really positive. And I'm, I just it's put me in a good mood today. I'm always in a good mood, but today it just tells me that people are listening, and I always look at what's happening around the world, no matter if it's south of the border or anywhere. And everyone is really, really doing a great job. And I'm going to go back to Minister Lecce. He's a modest guy. He's very, very, very humble. But what we've seen in our schools is really amazing. With 14.5 million people, we have 2 million students, a couple 100,000 teachers, and there hasn't been any outbreaks in the last few days. And I give all the teachers, I give all the custodians and the parents and the principals and the school boards all the credit. But this guy behind me, he put that plan together with conjunction and collaboration with all those people, and it's working. And again, it's the people. We always see these little bumps in the road through COVID, as everyone does. But with the support of the 14.5 million people, everyone pulling in the same direction, I'm so proud of everyone in Ontario, and I'm proud of all my ministers and MPPs. Everyone's trying, but I just want to say, Minister Lecce, you did a very good job. Let's keep it up, and let's not let our guard down at all. So things are looking real positive so far. But I've said that before, and it scares me because it comes back and bites you in the butt real quick if we don't follow it up.
Follow up.
Yeah, and to that point, it doesn't feel like it out there, and maybe you're seeing things that haven't been made public yet, which is fair enough. I think there's a malaise out there. There's a real fatigue out there that people feel like no matter how many sacrifices they make and try to do the right thing, those numbers just don't come down quickly enough. And then the Prime Minister suggesting yesterday Christmas may be affected. What do you say to those notions? And do you think Christmas will be affected? And what do you say to people who are just really down because because of how long this has gone on.
Yeah, Graham, you nailed it, really. You see the fatigue out there. You see people frustrated, business owners frustrated. I'm here to give them hope, and we will get through this. We'll get through it together, and we're working together, and we do see the spread going in the other direction, downwards, opposed to upwards. And folks, we'll do everything we can to make sure we open up the fitness clubs and open up the restaurants based on some good health advice, good policies amongst all the mayors. So I agree. People get tired, but I got to give them hope. We will get through it. We're doing so much better than everywhere else in the world. So we'll get back at it. We will. And as for Christmas, it's still a couple months away. So let's take a look down the road there. But I love Christmas. Everyone loves Christmas, and any holiday, religious holiday in that area. They want to be with their families. I get it. So let's all work together and let's make Christmas happen. Let's always think of the glass as half full. Let's not think of the glass as half empty. We can do it. We will do it by working together.
This will be the last question.
Last question comes from Dave Woodard at Global News Radio, 640 Toronto. Please go ahead.
Hi, Dave.
Thank you. My first question is for Minister Fullerton.
Yep.
Knowing what we now know about the pandemic, the effect that it had on seniors in long-term care homes and nursing homes specifically, is there anything that you would have done differently to both prevent the first outbreak from happening and to improve the mental health of the residents?
Well, thank you. And I think that's a really important question, particularly around the residents' mental health. I think when this started, we were looking around the world, seeing what was going on in Spain and Italy and other countries, and understanding the risks here. And we followed the advice of the Chief Medical Officer. Their directives were issued to our homes, and there were so many efforts to communicate with our homes, it was often overwhelming for them. But looking at the caregiver piece particularly, the duration of this is something that we've never seen before. This wasn't just a couple weeks. It went on for weeks. And so as we attempted to really strike the right balance between the safety of residents and staff in the home and the ability of their family members to get in to see them, we were using the advice of the medical experts and the Chief Medical Officer, the Assistant Medical Officer of Health, and really understanding what we can do to balance that. So I think we've struck the right balance with the caregiver, the dedicated caregiver piece. I think in hindsight it would have been better to have them in sooner. But again, the risks that we were mitigating with the safety of residents and staff really had to be balanced.
Follow-up?
Yeah, the follow-up, is it possible then to balance the mental health of those residents while keeping them under lock and key in that, iron ring to keep them safe?
So I think in the first wave, what we saw was, a global competition for personal protective equipment, for the testing components, including the reagent. Now we have a very different setting. We have adequate supply of personal protective equipment thanks to all the efforts to make sure that Ontario is self-sufficient. Or relatively self-sufficient, much more than the first wave. And also for the testing that we're doing. We're bringing in the rapid tests, and those will make a difference to another layer of protection, because you've heard many people say this, that once the community cases start to rise, it really does get hard for our long-term care homes to keep it out. So all these measures, whether it's every 14 days, the screening of staff, caregivers, people coming into the home, residents on an ongoing basis, if there's an outbreak in the home, to make sure that screening is done. The rapid tests are being implemented to provide another layer of scrutiny. We really have to have that surveillance for our homes, and that will be going forward. That is going to help, but we're already seeing the differences in the first wave compared to the second wave. Our homes are doing much better. We're getting that integrated approach with the IPAC teams from the hospitals, the infection prevention and control teams, that integration that is already set up. And I'm pleased also to say thank you to the commissioners who have provided us with early guidance. And I'm also happy to say that we are largely aligned and much progress has been made on their recommendations already. So we're definitely moving in the necessary direction, and I'm very hopeful that more measures like the rapid tests will be even additional measures. Thanks for the question.
Thanks, everyone.
Thank you, everyone.